healthy industrial executive consults with one of a battery of doctors during a thoroughgoing, week-long medical checkup arranged by his employers. Back at the plant, much the same interest is evinced by his firm in the health and safety of all employees. A full-time nurse is only part of a program for making sure everyone in the organization is healthy and sound, for his sake, for the sake of his fellow workers, and the sake of the organization itself. Helping to extend the increasingly popular in-plant medical program to more and more companies is a caravan of trailers, a completely equipped clinic on wheels, operated out of Asheville, North Carolina by Occupational Health Services. It ranges far and wide, visiting factories, mills, and offices in big cities or rural areas, bringing to all an assortment of the diagnostic tools of modern medicine few plants could afford or would even need on a full-time basis. Here we see how they set up for a visit. Electricity and water are hooked in, and the two bigger trailers are linked by a passageway. In twos and threes, plant employees report to the mobile clinic for either a diagnosis of a specific complaint or just a periodic physical examination. The unit averages 3 workers every half hour. First, they prepare medical histories, very important both for following up on an individual's progress and for statistical purposes. Then comes a series of tests, examinations, and analyses involving all sorts of equipment, the most familiar of which is perhaps the X-ray. The people who travel with the unit lean heavily on the plant's own doctors and nurses, where there is such a staff, and also frequently call upon other local members of the medical profession for assistance. Here's an example of how thorough an examination can be in this roving clinic. The man is undergoing a tonometry test, which would reveal signs of glaucoma, abnormal pressure on the eyeball. Persons being considered for employment in the plant can also receive their pre-placement physicals during visits by the clinic. There is, of course, no treatment administered in the unit. The smallest of the 3 trailers is the laboratory, and it has personnel and facilities for analysis you might expect to find only in a good-sized hospital. Among the important aspects of this service is the keeping of comprehensive medical records of lasting value to the company, the employee, and his personal physician. Now we're on our way to the next plant, and a stopover that might last 1 day or 2 or a week or more. Altogether, this appears to be a way of extending to any plant the kind of employee health service a number of industries have maintained for many years.